life have been impacted by the amazing services that New York City has here for the community. So that was a reason why I wanted to join the Community Health Corps.
I was very excited by being able to use my skills, what I've learned, to serve society, and especially to help society in a way that focuses on the most vulnerable. And also, I just have a general interest in health, and I want, in the future, I'm planning to go into a health career, so I thought it would be a great experience.
Because I wanted more direct patient care before applying to med school.
So as a prenatal coordinator, I organize and facilitate our prenatal groups. I also offer individual patient education and case management services.
Re-engaging mental health patients who have stopped coming to their appointments and connecting them to the appropriate community resources.
Meeting with patients one-on-one in clinic and talking to them either about diabetes if they have it and giving them the tools they need to better take care of their health.
At our site, we're going to be facilitating groups around chronic disease self-management.
I give information, health information to students in public schools in the Bronx and to parents and staff members in public schools, empowering them to make healthier decisions in their lives.
I would say that meeting a teenager who in the beginning she really didn't want to tell anyone in her family that she was pregnant, but after talking with me, talking with the doctors multiple times, she worked up the courage to tell her parents, her family, her sisters, that she was pregnant. And then for the rest of her medical visit, she came in with her mom, and her mom was there for her birth, and it was really great for me to be a part of someone finding a part of themselves.
I don't have a single significant experience, but I do have many moments when I get feedback from patients on how appreciative they are of the service that I've given them. Every now and then when I'm tired or unmotivated, I like to think back on how the work we all do in healthcare, it doesn't go unnoticed by the patients.
When I went into a patient's room that I'd seen several times before and had taught similar, like the same thing over and over since they were high-risk patients, and having them reiterate what I had told them and telling me how they had changed their life and for the better, and what ways that made them feel more empowered, more accountable for like their health, and ways that they were planning to continuously improve their health. An awesome feeling to know that what I said like 4 months ago changed somebody's course of life in just a small period of time.
I've learned what it is I do and don't want to do. I have further defined my strengths as a leader, and I realize I really love planning large-scale public health initiatives, and it's definitely geared my future towards that. So I'm looking to continue a health career, but in a more management and big picture focus.
My next step is going to medical school, and I think having had to navigate insurance for my patients is really going to help me in the future for providing them care, especially in knowing what they can afford and knowing to ask them what they can afford.
What I've seen by working in the community health center is just how much of an impact it can have for a doctor to take the moment to really listen to their patient and to approach their patient with a thoughtful and intentional ear and the intentional attitude, and to really approach their patient with caring, and how much of an impact just that individual encounter can have. And that's really inspired me in my career in medicine.
It's really been really eye-opening, super transformative, and really to see just honestly how the social determinants of health, how they play out. It's not just what their doctor's appointment or their diabetes prevention group, it's what's happening at home, it's what's happening in their community, and just really being able to see how all of those factors affect their health, I think will really make me a much better health provider. You know, if I do happen to go into policy, I'll actually remember what's happening on the ground, recognizing that healthcare isn't happening in a bubble. It's a huge system, and at any given time there's like 50 things affecting a patient's health, and just being cognizant of that and recognizing that when we interact with them is just really important.
Ever-changing.
Rewarding.
Challenging. Exhilarating.
Eye-opening.
Life-changing.
Fun!